I want to use this model to go over the parts of the upper respiratory tract. So the air enters in through the external nares, your nostrils. So then just beyond that you have this region called the vestibule. And then now you're in the nasal cavity. The nasal cavity has a nasal septum, separating it into two halves. On the nasal septum you see the nasal concha, superior, middle, and inferior nasal concha. In between them there's these little passageways that the air goes through. Those are called meatus, superior, middle, and inferior meatus. You have this region here called the internal nares, and in that particular hole, that's the opening to the auditory tube, which connects to the middle ear and allows you to adjust the pressure in that area. Separating the nasal cavity from the oral cavity is your palate, which you can see is partially bone, which is the hard palate, and then posterior to that is the soft palate. The soft palate extends down a little bit. This is known as the uvula. So in this region here, this is called the pharynx. Okay? The pharynx has three parts: the nasopharynx, oropharynx, and laryngopharynx. In the pharynx you can see some tonsils. You have the pharyngeal tonsil up top. You have the lingual tonsil over here on the base of the tongue. And then you have the palatine tonsil right there. So as the air passes through, it moves down through these regions of the pharynx, and then you can see this is the epiglottis. It's standing up, and it's made up of elastic cartilage, very flexible. So when you're breathing, this is up, and the air can move into your larynx. But when you're swallowing, this closes off the airway, and then the food is redirected down here into the esophagus. When you look closely at the larynx, you can see some parts, these two folds. Superior fold is called the vestibular fold, also known as false cords. Underneath it, the inferior folds. This is the true vocal cords, also known as the vocal fold. In front of that, you can see the thyroid cartilage. Just inferior to that's the cricoid cartilage, and that extends all the way back here. That's still also the cricoid cartilage. The hyoid bone supports the larynx. You can see the thyrohyoid membrane right there. There's an additional model of the larynx, much larger models. You can see the parts up close, but that should do it as far as this model in the upper respiratory tract.